This is Virginia Parsons with Nevada Hangout Local, and I'm here today with Dr. Kristie Jones, Oriental Medicine doctor and acupuncturist. Welcome, Dr. Kristie. Give us a little background to start out with. Tell me a little bit about what attracted you to Oriental medicine and how you got your practice started.
Well, I've always been interested in healing and helping people, and then I started looking into programs to become an herbologist, and I noticed right away that all the programs were coupled with acupuncture, so it was acupuncture and herbology. So I didn't really know that much about acupuncture, but I decided, why not? Let's just try it out, and if I don't like it, then I can just study the herbs. But I fell in love with it from the first day. So.
Terrific. And so how long have you been practicing?
I've been in practice now for 2 years.
And your office is here at Perfect Balance Therapies, correct?
Yes. We're located in South Reno.
Terrific.
Beautiful complex.
Yes, it is. I love it here myself. What I'm going to do, Dr. Kristie, and you don't mind if I call you Dr. Kristie, do you?
Not at all.
Okay. It is Dr. Kristie Jones, just for those to make sure they know. I'm going to pan around your office so they can get a feel for, how comfortable it is to be here. And that's a very inviting thing for your patients, I know. So as I'm panning around, is there anything you want to share with potential patients or people watching this?
Well, I guess I could talk about what to expect on your first visit. I always allow for the first visit to be an hour and a half, just so we can get a thorough history of your health and what's going on with your current health situation. And then it also allows for plenty of time for the full treatment with the needles and any other modalities that you might need, such as cupping or gua sha or anything like that.
Great. Now tell me a little bit more about those needles. Isn't that one of the misperceptions people have about acupuncture?
Yes, a lot of people think that acupuncture is going to hurt and then it's really painful, but it's not. The needles that we use are very thin, and they are meant to part the tissues, which is a huge difference between the kind of needles that are mainly used in Western medicine for like injections and IVs and whatnot. Those needles are a lot thicker, and they are also designed to cut the tissues. That's why you feel a lot more when they use them. And if you go to a fully trained acupuncturist, which I hope all of you do, we spent thousands of hours of training to learn how to properly insert the needles, so we know how to do it in, most painless way possible.
Well, I've also heard quite a bit about cupping, and it seems to me that that's something that's increasing in awareness and popularity. What can you tell us about that?
Cupping has become very popular, especially with people in the media doing more cupping. Like recently Jennifer Aniston was in the media showing cupping marks on her back at a certain event. But what that is I use glass cups and fire to create suction. And what that does is it draws the tissues up into the cups and creates like a myofascial release. So what that means is it separates the muscles from the connective tissue to allow new blood and new fluids to come into the area, as well as draw up old toxins and old blood that were stuck in the muscle layer up to the surface so they can be broken up and leave the body.
Okay, so Dr. Kristie, explain to me what these devices are.
Well, these are the cups that I use for the cupping therapy that we mentioned earlier. They're just kind of glass, domes that sit on the skin like this. I use fire to create a suction, so the tissues will actually be drawn up into the cup. And then I always put oil down on the skin, so sometimes I slide the cups around, which is really wonderful to help break up adhesions in the muscles, which, are those nice knots that everybody has, or it's also great for breaking up scar tissue and all kinds of things like that. Really, it's just wonderful for relieving tension in the muscles. And I have, as you can see, all different sized cups for different parts of the body. This is a really big one. And then I have little small ones that I usually use on the neck or on the arm in different places. So.
All right, so I'm up on Dr. Kristie's table, and she's about to demonstrate how she inserts needles, and since I have an injury on my foot, she's going to start there. So tell me a little bit about what you're doing now, Dr. Kristie.
Right now I'm just kind of sanitizing the area with some alcohol. We're just going to do a kind of a localized treatment right now. So.
Okay.
Is this tender over here?
Not too much there, just further up and in.
Okay.
Yeah, that area's okay. So she's going to help me get that foot healed faster. That's the whole point.
Yes. That is what we're going for.
One of the other things that I like to come to Dr. Kristie for is just an overall energy balance. I always feel just so relaxed and balanced and calm after coming. Now you can see that she just put a needle in there. I didn't even feel it. And then she sort of spins it around. And as she spins it around, I might get a little impulse from that.
So now I'm just doing some other points that kind of correspond to what I'm trying to, the results I'm trying to get for your foot.
Look at that. It's so little I can't even find it in the camera. Where'd it go? There it is. Look at that tiny little thing. So one of the things I can emphasize is you don't have to be afraid of this procedure. It's really actually quite comfortable, and even though every once in a while I feel a little electrical twinge as she connects to a point and I can feel it moving a little bit through my body, it's not at all uncomfortable. Do you have something that you might be able to offer potential clients so that they can experience your services?
I'm excited to offer you guys, if you mention this interview, then you can receive a free initial consultation worth $40 and 20% off of your first treatment.
That's very exciting. I'm sure they'll appreciate that. Thank you, Dr. Kristie, for joining us today and sharing your expertise with our viewers.
Thank you, Virginia.